Hi everyone. Now we are going to discuss one important question. Nursing intervention designed to decrease the risk of infection in a patient with an indwelling catheter include. So in this question what they are asking, how to decrease the infections in indwelling catheters like Foleys catheter. When patient will be having the indwelling catheter like Foleys catheter, that time how can we reduce the infections? So coming to the options, cleanse area around the meatus, empty catheter drainage bag at least daily. C option, change catheter tubing and bag every 48 hours. And D option, maintain fluid intake 1200 to 1500 ml every day. In this question, different options. So first coming to the A option, cleanse area around the meatus. This is the option, correct option. In this option, give the perineal care with mild soap and water, including the cleansing the area around the meatus twice a daily to decrease the risk of infection in the patient with indwelling catheter. So daily, when the in ICCUs, in wards, when will be the Foleys catheter patient, we need to maintain some precaution. Catheter association, catheter associated urinary tract infection bundle will be there. So in that bundle, daily we need to change the dates, and daily we need to clean the Foleys care we should be provided. So how we will be providing the catheter associate this care? Foleys care means by taking the sterile, by after washing the by doing the hand wash, after assigning all the equipments, after explaining to the patient, we need to providing the privacy, we need to clean the after exposing by exposing the area. Then we have to clean the around the perennial care we have to provide. How? By taking the betadine. First we need to give stroke from upper to bottom, only front to back, not again from top to bottom to top, like that we should not rub. So from the ureteral meatus to down we have to only one stroke with the betadine cotton swab we need to clean. Then again another swab, for one swab for only one time use we have to provide. Then by cleaning that we have to properly cover the patient. Then explain everything is fine, like that. If anything discharges, any foul smell, if any problem is there, any leakage, like that, we need to inform to doctors. So after that we need to explain to the patient. Then coming, take out all the equipments, then wash and send to the sterilization. In these options explanation, they are giving nice explanation. Give perineal care with mild soap and water, including the cleaning area around the meatus twice a daily. Actually we will be providing in the hospital settings, we will provide only one time in the morning. While giving bed bath we will provide the Foleys catheter to decrease the infection. By doing this daily, cleansing this area, indwelling catheter area, this will be decreasing the risk of infection in the patient who will be having the indwelling catheter. Empty the catheter drainage bag every 8th hourly or 2/4 full. So what the catheter drainage bag will be there, na? So we need to empty. If we should not wait for till it get full. If it is 2/3 only, we have to call the housekeeping staff, we need to get empty it. So 8th hourly regularly, by we will be changing the shift wise, we need to change it. Because of the retention of the urine in the bag, it will be excellent media for the growth of the microorganism. So what will happen? This E. coli bacteria will be having the very good characteristics, that it will be go from down to bottom, down to top, like from descending manner also, descending manner also it will go from from down back to, it will go to the urinary catheter also. It is having very great characteristics. So we need to empty the bag daily by 8th hourly, when it will be getting 2/3 full only. Change the catheter tubing bag at specialized interval according to the international policies. So we'll be having some policies to change some particular bag tubings like that. So we need to change this catheter tubings also according to our hospital policies. Maintain the drainage tubing catheter below the bladder level to flow the urine bag by gravity. So we should maintain some physics also. We should be hang that urinary catheter bag at the below the gravity level only, from the patient bladder to low gravity area. We should hang that. If patient sleeping on the bed, it should be down to the bed, like that we need to hang. So what will happen, it will flow directly to the urinary bag. If it will be not flow, if we are not keeping it down, we are not keeping the bag down, what will happen, the flow will be obstructed, the urine will be stagnated in the bladder itself. So we need to hang it in the below the level of flow, urine bag by gravity. Maintain adequate intake of 2000 to 3000 ml per day unless contraindicated. So we need to encourage the patient to drink 2000 to 3000 ml of water daily. So it will help to decrease the urinary tract infection. If we are COPD patients, renal patients, like if only 1 liter per day, like that, some restrictions will be there for some type of diseases. In that type of patient, we should not encourage. According to the patient doctor's advice only, we need to follow in that type of condition. If we will be having some patients urinary tract infection patient, what we have to encourage, daily 2000 to 3000 ml of water adequately intake should be encouraged. So in this question, what they are asking, decreasing the risk of infection patient with indwelling catheter, how we can clean the around the meatus daily, then encouraging the patient to drink daily 2000 to 3000 ml of water, and by keeping the urinary bag down below the bladder level to help in gravity. Change the tubings according to the hospital policies. Every shift wise we need to check the patient. Nowadays urinary bags also urometer will be coming, so only per 1 hour it will be calculated, so that what will happen, according to the intake and output chart will be maintaining. So in that also we should see that urometer. Then we should empty every hourly the total urinary bag. 8th hourly we need to empty, or 2/4 when patient will be the bag patient will be having, due to the increase intake, the patient will be having the outflow also more. In that condition we need to empty the bag. When it get 2/3 full of bag, we need to get empty, like this. These type of methods when we will be practicing, so it will be helping the decreasing of the risk of infection when the patient will be having indwelling catheter.